I have dark spots under my eyes. Will laser help remove my dark spots under my eyes? My question is, will laser help remove my dark spots under my eyes?
Thank you for your question. You submitted a single photo with your eyes closed and you're asking, will laser help remove the dark spots under your eyes? And the photo is taken at a distance, so I actually see more of the broad picture and not so much the detail under the eyes, but I think I understand what you're asking. So I'll give you a sense of how I counsel patients like yourself who come to my practice about this type of situation. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. And the challenge before us every day in our practice is dealing with people who are concerned about dark under eye circles. And I think that's really the core of your issue, is you have dark circles under the eyes and you want to know if laser will remove those circles. And it's understandable why you're asking this question. We are immersed in incredible claims made about the benefits of lasers. And unfortunately, that tends to confuse a lot of people, because we have to differentiate what a laser does and how does it fit into this type of issue. So let me just go through the steps of how I evaluate a patient like you, and what I want to do first, to define the problem and then define the solution. So let's start with the under eye area. What do I see when I see the under eye area? First, I notice some puffiness. So understanding that the puffiness is not a skin issue, but rather something called lower eyelid fat prolapse. Lower eyelid fat prolapse means that the fat pockets that are normally around the eyes have pushed forward and created these bulges. Now, if this puffy area is really not something that's constant and is either fluid or just happens to be the way the photo was taken, we can at least understand that if there's puffiness, that a laser doesn't really specifically remove that without its application in a more interventional approach. For example, when we deal with under eye bags on puffiness, we perform a procedure called a transconjunctival blepharoplasty. This is a procedure where the fat pockets that create this type of puffiness are reduced from the inside of the eyelid. Now, I prefer that technique, especially for people who have, let's say, darker skin types. And that means anybody who has like a light olive skin tone and darker. The reason for that is that generally there's no evidence of extra skin, and you avoid issues with incision in terms of the discolorations or scarring, even though those are also not major, but it doesn't justify making an incision if you can avoid it. Beyond that, and on the topic of skin type, that is where one of the major decision points about choosing a laser treatment or an alternative treatment becomes absolutely critical. Laser is the use of a particular wavelength for a certain amount of time to target a particular type of what's called a chromophore. And the three major ones are blood, water, and melanin. Now, when you look at someone with dark circles under their eyes, we have to ask ourselves, what of those elements are related that can potentially have a role with laser? But beyond that, I would say it is very important that you also consider what kind of impact laser has when you do a treatment. So there are lasers that, let's say, target water. Well, those are the lasers that can be done fractionated or ablative to remove top layers of skin. the top layers of skin can also contain some pigment that could help make the dark circles look better. There are also lasers that target the pigment itself, called melanin, and there are other lasers that also target blood. Now the point of this is first understanding whether or not a laser would potentially cause someone with a darker skin type to actually make the area look even darker. So in that respect, you have to be mindful of where laser fits in. For example, when we treat dark under eye circles, and if it's in combination with or without addressing puffy under eye bags, we routinely actually first do we'll do a combination of platelet-rich plasma, which is derived from your own blood, and it has a concentration of wound healing and growth factors that stimulate collagen and improves the appearance of dark circles. We've done this very successfully as a standalone procedure without laser. Basically, getting the benefit of improving skin quality, improving the texture and health of the skin, and it's actually been shown that platelet-rich plasma prevents hyperpigmentation, and it actually can be used in situations where there is hyperpigmentation. That's been shown in formal studies. We've seen this clinically for years. So I think that although there are a lot of options, I think laser may be something that could have a place in your treatment plan, but I think that you can also consider other options before going with laser. I think it's natural to ask this question because people are so fascinated by lasers, and certainly this industry of aesthetic medicine makes really continuously hypes new lasers, and there's some basis, but unfortunately a lot of times the hype and the usability don't always go together. A laser is a tool, and it may have a role in your treatment, but it cannot be a standalone type of tool, in my opinion. If I do a laser, I often combine it with platelet-rich plasma because I want to get the benefit of the laser as a resurfacing tool, and the platelet-rich plasma as a way to improve skin quality and texture. Sometimes even injectable fillers can also have a role in improving dark under eye circles. So you can understand there's a lot of different elements that can be used to address particular anatomic issues. I think that you have to, at this point, make some decisions about choosing doctors to meet with and have proper consultation and learn about what the recommended options are. And I would even go so far as to say that when you meet several different doctors, you are going to get a lot of different opinions. So you have to find a doctor that you feel comfortable with and you feel makes sense with your unique situation. Remember, skin type is very, very important. The same modality that I would use for a lighter skin type person, like let's say an Irish blue-eyed person with dark circles, is very different than what I do for, let's say, an Indian or Arab skin type, someone who's brown, and then further an even darker skin type like someone of African origin. So it really has to be customized. So I hope that was helpful. I wish you the best of luck, and thank you for your question.